Welcome back to this video. In this video, I'm going to talk about 3 areas of concern for young parents. We are going to talk about stools in the newborn, we are going to talk about vomiting in the newborn, and we are going to talk about colic. Now, young parents are always confused and worried about the stools in a newborn. Now, let me tell you something. Stools in your new baby will change from day to day, and sometimes even in one particular day, the stools may be different in character. Now, the first stool that your baby is going to have is soon after birth or within the first 24 hours, and that is called the meconium. It's very sticky, it's black or dark green in color. And a lot of mothers get very worried when they see a diaper full of this black substance. But that's the first stool that your baby is going to pass. Now, over the next few days after birth, the stool color changes from yellow to green. So sometimes you have a yellow stool, sometimes you have a green stool. And the stool has a very seedy and a very chunky character to it. And then the seeds and those particles in the stool are milk byproducts which are not yet been able to be digested by the child or the baby, because the digestive system is still a bit immature, it's new, and is finding its way into how to handle the milk feeds. Now, generally, in a breastfed baby, the stools are much runnier and much thinner than in a bottle-fed baby. So in bottle-fed babies, the stools are a bit more formed as compared to breastfed babies. Now, an ever important question for all parents: how many stools is my baby supposed to have in a day? It varies. Some babies will have a stool with every feed. So every time they feed, there's something called a gastrocolic reflex and the baby has a stool. Some babies will have 6 to 8 stools in a day. So around 8 stools in a day is quite normal. Now, because of this number of stools, sometimes parents get confused and they come to the clinic and say, my baby has diarrhea. Now, diarrhea is a separate condition totally, where the stool will be very mucousy, very sticky, and very foul smelling. And diarrhea is often accompanied with a pretty severe nappy rash, because in diarrhea you get very acidic stool. Because the intestine cannot digest lactose, you get a lot of lactic acid in the stool, and that burns the nappy area. So don't confuse between the number of stools in a normal baby with diarrhea. Now, the other end of the spectrum, parents also worry if the baby doesn't have a stool for a day. So they will call me or come to the clinic, my baby hasn't had a stool in the last 24 hours. Doesn't matter. No cause for concern. Sometimes babies may not have a stool for 2 or 3 or 4 days. As long as the baby is feeding well, as long as the baby is looking well, sleeping well, and happy, there is no cause for concern, even if there is no stool for a few days. So that was about the stools. Now, the second topic we'll touch on is vomiting. Now, vomiting is a very, very common thing in the first few weeks of life, and babies tend to vomit very frequently. That is just because the babies are getting adjusted to the feeding pattern and to the food that the baby is being offered. Anytime you move the baby, you are changing the baby, you pick up the baby, put the baby on your shoulders, the baby can vomit. Now, vomiting should not be confused with posseting. Posseting is just a few teaspoonfuls of milk that comes out and just sort of comes to the angle of the mouth and dribbles on to the neck. That is posseting. Vomiting is much more pronounced as opposed to the posseting. Now, vomiting in an otherwise healthy baby is of no concern and usually settles down with time. As the baby grows, in a few months' time, this settles down. Now, if the baby is sick for some reason, if the baby has got a fever, if the baby is still vomiting and not looking very well, then things like urinary tract infections or an ear infection, they have to be ruled out. If you find that the baby is very irritable and the fontanelle, the soft spot, is bulging and the baby is not looking well and is drowsy and irritable and vomiting, then you need to take the baby to your doctor to get the baby checked out. So there are conditions where the baby is not well and the baby is vomiting. The second one is projectile vomiting, a very forceful vomiting where the vomit comes out with a lot of force and goes to a distance within half an hour of feeding. Now, when that happens, then there's a condition that has to be ruled out that's called pyloric stenosis. That is the lower end of the stomach where it joins the intestine. Sometimes that's a bit tight because the muscles around the valve in that area, they are very, very tight and the stomach cannot empty. So when you feed the baby, the stomach is full, it doesn't empty, and the baby has a projectile vomiting. So this has to be seen by the doctor, and in many cases it requires a tiny little bit of surgery to release that blockage and to facilitate the passage of the milk from the stomach to the intestine. The ever challenging question for me, colics. My baby has colic, what do I do? Now, colics usually happen or start around the second week after birth, and they can go on for as long as 6 months. The definition of colic per se is, in an otherwise healthy baby, if the baby is crying for more than 3 hours a day, that is the definition of colic in an otherwise healthy baby. Now, what are the causes of colic? No one really knows. I have done this for 30 years, more than 30 years, and people will give you all kinds of reasons for colic. I mean, it can be milk intolerance, it can be lactose intolerance, it could be just a reflux, where the milk pushes through from the stomach into the esophagus. It could be just a weak digestive system in the baby. It could be a lot of air or gas that the baby has swallowed during feeding. So any of those things can cause pain and cause colic. However, if your baby is crying excessively, rule out other causes of crying. Make sure it is not trauma. The baby is not in pain, the baby is not bruised anywhere, there is no ear infection, there is no urinary infection. So all those things have to be ruled out. So if the baby is looking a bit sick and the baby is crying excessively, please take the baby to the doctor to make sure that it is not just colic and there is no other serious cause for crying. Now the million-dollar question. What do I do for colic? I wish I had the answer. I mean, we can try all kinds of tricks and all kinds of things to quieten a baby when the baby is irritable and crying. You can swaddle the baby, you can hold the baby close to your chest, you can lay the baby on the tummy and massage the back. You can rub the tummy of the baby, put a hot water bottle over there. All kinds of things. You can hold the baby upright just in case there's a reflux. You can try giving some gripe water. You can give some colic drops, fennel tea, chamomile tea. All those things, tidbits you can try. Sometimes you can change the formula, from one baby formula to the other. You can try giving a lactose-free formula or a soya formula. So there are a lot of combination of things that you can do for colic. There is no specific treatment for colic. And as I said, that this will usually settle down with time. And if the baby is otherwise healthy, you don't have to worry about it. Just give it time. But if there's a cause for concern, then please consult your doctor. Thank you for watching this video. I'll see you in the next one soon.